intro.
1. Important. Never give aspirin to children under 16 unless their doctor prescribes it. To make sure aspirin as a painkiller, including mouth gel, is safe for you, tell your doctor or pharmacist if you have an allergy to aspirin or similar painkillers such as ibuprofen. Ever had a stomach ulcer? Recently had a stroke? Although depending on the kind of stroke you've had, your doctor may recommend that you take low-dose aspirin to prevent another one. High blood pressure, hypertension, indigestion, asthma or lung disease. Ever had a blood clotting problem? Liver or kidney problems? Gout, it can get worse for some people who take aspirin. Heavy periods, they can get heavier with aspirin. If you're pregnant, trying to get pregnant, or if you want to breastfeed, check with your doctor that it's safe for you to take aspirin. 4. How and when to take it. The dose of aspirin that's right for you depends on the kind of aspirin you're taking, why you're taking it, and how well it helps your symptoms. Aspirin tablets. Aspirin usually comes as 300 mg tablets. The usual dose is 1 or 2 tablets every 4 to 6 hours. Important. Do not take more than 12 tablets in 24 hours. Wait at least 4 hours between doses. Aspirin comes as several different types of tablet. Standard tablets, that you swallow whole with water. Soluble tablets, that you dissolve in a glass of water. Enteric coated tablets, that you swallow whole with water. Enteric tablets have a special coating that may make them gentler on your stomach. Do not chew or crush them because it will stop the coating working. If you also take indigestion remedies, take them at least 2 hours before or after you take your aspirin. The antacid in the indigestion remedy affects the way the coating on these tablets works. You can buy aspirin tablets and soluble tablets from both pharmacies and supermarkets. Aspirin suppositories. Aspirin suppositories are medicine that you push gently into your bottom. To use them, follow the instructions on the leaflet inside the packet. Aspirin suppositories come in 2 strengths. They contain 150 mg or 300 mg of aspirin. You can buy them from a pharmacy. If you're taking 150 mg, the usual dose is 3 to 6 suppositories. This is 450 mg to 900 mg every 4 hours. The maximum dose is 24 of the 150 mg suppositories in 24 hours. If you're taking 300 mg, the usual dose is 1 to 3 suppositories. This is 300 mg to 900 mg every 4 hours. The maximum dose is 12 of the 300 mg suppositories in 24 hours. If you need a dose of 450 mg or 750 mg, your doctor or pharmacist will give you a mixture of strengths and explain how to take it. Important. Do not use more than 24 of the 150 mg suppositories or 12 of the 300 mg in 24 hours. Wait at least 4 hours between doses. Aspirin mouth gel. You can buy aspirin mouth gel, Bonjela, from pharmacies and supermarkets. Do not give Bonjela to children. You can give Bonjela teething gel or Bonjela Junior to children as they do not contain aspirin. For mouth ulcers or sores, massage about 1 centimeter (half an inch) of gel onto the sore area. Apply it to the inside of your mouth or gums every 3 hours as needed. If you have dentures, false teeth, take them out before you apply the mouth gel. Then wait at least 30 minutes after applying the gel before putting your dentures back in your mouth. What if I take too much? Taking 1 or 2 extra tablets by accident is unlikely to be harmful. The amount of aspirin that can lead to overdose varies from person to person. 5. Taking aspirin with other painkillers. It's safe to take aspirin with paracetamol or codeine. But do not take aspirin with ibuprofen or naproxen without talking to a doctor. Aspirin, ibuprofen and naproxen belong to the same group of medicines called non-steroidal anti-inflammatory drugs, NSAIDs. If you take them together, aspirin plus ibuprofen or naproxen may increase the chance of you getting side effects like stomach ache. Speak to a pharmacist if you're unsure about dosages and timings when taking aspirin with other painkillers. 6. Side effects. Like all medicines, aspirin can cause side effects, although not everyone gets them. Common side effects. Common side effects of aspirin happen in more than 1 in 100 people. Talk to your doctor or pharmacist if the side effects bother you or do not go away. Mild indigestion. Bleeding more easily than normal. Because aspirin thins your blood, it can sometimes make you bleed more easily. For example, you may get nosebleeds, bruise more easily, and if you cut yourself, the bleeding may take longer than normal to stop. Serious side effects. It happens rarely, but some people have serious side effects after taking aspirin. Call a doctor straight away if you get red, blistered and peeling skin, coughing up blood or blood in your pee, poo or vomit, yellow skin or the whites of your eyes turn yellow. This can be a sign of liver problems. Painful joints in the hands and feet. This can be a sign of high levels of uric acid in the blood. Swollen hands or feet. This can be a sign of water retention. Serious allergic reaction. In rare cases, it's possible to have a serious allergic reaction, anaphylaxis, to aspirin. 8. Pregnancy and breastfeeding. It's safe to take aspirin as a painkiller in the first 6 months of pregnancy, up to 30 weeks. Do not take aspirin for pain relief after 30 weeks of pregnancy. It can cause complications, including breathing and blood clotting problems, in the newborn baby. For most women, paracetamol is the best painkiller to take in late pregnancy. If you've taken aspirin after week 30 of pregnancy, especially if you've taken it for a long time, tell your doctor or midwife straight away so they can check the health of your baby. For more information about how aspirin can affect you and your baby during pregnancy, visit the Best Use of Medicines in Pregnancy (BUMP's) website. Breastfeeding and aspirin. Aspirin is not normally recommended during breastfeeding. For most women, it's better to take paracetamol or ibuprofen to control pain or fever while you're breastfeeding. 9. Cautions with other medicines. Some medicines interfere with the way aspirin works. Tell your doctor if you're taking these medicines before you start taking aspirin. Medicines to thin blood or prevent blood clots such as clopidogrel and warfarin, taking them with aspirin might cause bleeding problems. Medicines for pain and inflammation such as ibuprofen and prednisolone. Medicines to prevent organ rejection after transplant such as cyclosporin and tacrolimus. Medicines to treat high blood pressure such as furosemide and ramipril. Digoxin, a medicine for heart problems. Lithium, a medicine for mental health problems. Acetazolamide, for an eye problem called glaucoma. Methotrexate, a medicine used to stop the immune system overreacting and sometimes to treat some types of cancer. Diabetes medicines, such as insulin and gliclazide.